I'll be just giving a brief idea of radiology and the plan. So, as already discussed, there are few or one or two important books which are mandatory that we have to go through when you're dealing with the individual subject. That most important thing after that is for your clinical subjects, I want you guys to keep one standard book as a reference. Okay, either to correlate the subject or to understand the subject well. So most of the MCQ books which are useful for this INBD or any sort of national based or international based exam, they don't let us to know which standard book they are following, but it is mandatory to follow one standard book for your understanding purpose. And I strongly recommend White and Farrow is one of the standard book that is followed throughout the world. So I'll be sharing that. I'll be sharing. I hope like most of you have that book. Okay. If not, we'll be sharing onto the group. Yeah, it is available as a PDF format in the Google, so you can download it. So I'm going to give a rough game plan. So initially, as said, I'll go a bit slow. So 10th and 11th, you need to cover radiation physics. 12th, we'll try to finish the radiation biology. 13th, I mean, like in most of the your books what you read, this intraoral radiology is mentioned as in the part of techniques. They mention it as a techniques, nothing but intraoral radiographic techniques. Okay, and please do make a note about processing, and your faulty radiographs are combinedly given in most of your books. Then the extraoral radiographic techniques. Then you have something called as anatomical landmarks, that is something called as normal anatomy. Radiographic normal anatomy is the topic in most of your books, which includes both the anatomy discussion both in the case of IOPA as well as in the case of OPG. There is next one something called as advanced imaging techniques, which was given with a tagline called as digital radiography. Digital radiography is nothing but it's an advanced thing. And in the recent papers, as per the reviews given by most of my friends and colleagues, even they're asking questions on CBCT, CT and MRI. So we'll discuss all those advanced imaging techniques. Then comes the radiographic diagnosis, which is not exclusive to radiology, but it will be combination of few subjects. Like we'll talk about the radiographic diagnosis point of view in the endo. Okay, I hope like few of you are already done with endo. So endodontics also, where you link up the case with a radiograph. Okay, open apex case with a radiograph, or pulp involvement case with a radiograph, or trauma with a radiograph, so many things with a radiograph. So similarly, you can this can be a part of your oral medicine radiology, or this can be part of your oral path, and everywhere like they link up with a radiograph. The next goes, of course, the integrated approach of NBD, that is the radiographic images and case-based discussions. We will have some talk, and the radiographic manifestations of systemic disease, followed by some topics of radiation medicine which were included in your miscellaneous part will be discussed, and followed by the revision and examination is on 22nd. Okay, stay positive, all the best, and keep White and Farrow as a star reference book. Done for now.